Hi everybody, Dr. Bingham here with the health update. Some of you may not be aware, but I did suffer a stroke about 3 weeks ago that affected my occipital part of my brain. That's the part of the brain that's responsible for vision. I did have a little bit of vision loss, but since then most everything has come back and my vision is almost completely returned to normal. The neurologists believe that that small visual defect that I have will return to normal probably within the next 3 to 6 months, hopefully. The cause of this, we believe, is due to a clot that traveled from one side of my heart to the other due to a hole in between the atrium. Atriums are the two top chambers of the heart that allow blood to come in, but it's supposed to go from the atrium to the ventricle. Instead, some of my blood will travel from the right atrium to the left atrium. I've since found out that I share this defect with Bret Michaels from the 80s hairband Poison. So he also suffered from a stroke for the similar reason. So I guess I'm in, I don't know if I'd say good company, but in some type of company. So what's happened since then, because of that hole, the doctors have gone in on Tuesday of this week. They went in, they put a what's called a Amplaster device, and I'll go ahead and put a link to that on the website here, and so you guys can see what it looks like. I think it's pretty fascinating what they were able to do. Through just a catheter, they're able to enter one of my veins, travel up to my heart, and then place this device in that area where the hole is to prevent any other clots traveling from one side to the other. So pretty much everything is returned to normal. I was on bed rest for the evening, and I am on weight restriction. I can't pick up anything over 20 pounds, so I will be out of the office for the remainder of this week and then also next week. I do have a chiropractor coming in to cover. Great chiropractor, has had tons of experience. He's been in the chiropractic profession for 43 years, and I put together a little video following this video so you guys can see a little bit about him. He'll talk about some of the techniques that he does, and he'll be here Monday, Wednesday, and Friday starting that week of the 11th. And if you have any questions, please feel free to give us a call. Send us an email. You can reach me directly at drdc@compassindy.com. And look forward to getting back to the office and seeing everybody. Thanks. Hi everybody, it's Dr. Bingham. I wanted to take just a moment to introduce you to Dr. Phipps, who's going to be covering for me when I'm going to be out of the office for the week of the 11th. So Dr. Phipps, if you could tell us a little bit about yourself. I know you've been doing this for a couple of years.
I sure have. For about 45 years. I retired from a practice in Iowa and been very active in chiropractic for 47 years. Lots of Con Ed, lots of things. Do a few different things. I do a lot of extremity work, and I can just pretty well duplicate almost anything that needs to be done. And we'll be more than happy to take care of your patients, and I promise you I will leave them in good hands.
Great.
Okay.
Thanks. And I've been treated by Dr. Phipps, great adjuster, and he does do some different techniques, things that kind of beyond what I do as far as some extremities, as he mentioned. By that he means, working on feet and hands. So if you have any of those complaints, he said he'd be happy to work on those and then kind of give me an idea of what he does, and then be able to pass that information along to me and how I can help patients that have some of those complaints. So thanks for being so helpful and understanding through this process. We really appreciate the help and all the kind words that people have sent our way here at the office. So look forward to getting back in the office and seeing everybody once everything is all said and done. Thanks.
And I look forward to helping out.
Okay.
Thank you very much.
Okay.
Okay.
All right.